Dengue fever is a mosquito-borne viral disease that has actually rapidly spread in Sri Lanka. It is actually transmitted by the female mosquitoes belongs to species Aedes. And once the mosquito is infected, usually this remains infected for its lifespan. There are distinct 4 types of viruses belongs to dengue virus, and once the one type is infected, usually the immunity or protection remains lifelong. But the issue is if the subsequent infection by a different virus group or virus strain, there may be a lot of complications. The other thing is usually this dengue fever doesn't spread or transmitted by direct contact person to person. Usually the common thing is the high fever. It can go up to even 40 centigrades. And other thing is they may be having headache and they may be having pain behind the eyes. So that is very important to suspect dengue fever. And other than that, they can have muscle or joint pains like in other viral diseases. They can have diffuse red patches or rash all over the body, and sometimes they can have some bleeding from the nose, gum, or as bruises, and they can have facial flushing also with the dengue fever. Sometimes it can be complicated as dengue hemorrhagic fever or dengue shock syndrome. So if the patient or child goes into dengue hemorrhagic or dengue shock syndrome, they can have complications such as widespread bleeding. They can have low blood pressure, or we call it shock due to bleeding or leak in blood vessels. Other thing what they can have is that organ failures like the liver, renal, kidney failures. Basically, you can manage a child at home initial phase by keeping him at with reduced activity and keeping at home and give him a lot of fluids. So child usually around 1 year more than 10 kilos, you can give about 1 liter per day, 1 liter per day. And the child more than 40 kilos, you can give about 2 liters per day. You can give any fluids with like oral rehydration fluids, king coconut water, porridge, kanji, fruit juices. You can give any juices or any fluids. Other than that, to control the fever, you can give paracetamol. Usually we give 15 milligram per kilogram body weight. Every 6 hours you can give to control the fever. We should not use any other drugs to control the fever. If fever is not getting under control with only with paracetamol, you can do the tepid sponging in the axilla and the groin, and can use a fan in the room. Other than that, if the child is having nausea or vomiting, you can use some medication for that. And usually you have to get a full blood count, we call it FBC, done daily basis to see what are the changes happening. And lastly, it's better to get the dengue antigen done either in day 1 or day 2 of the illness. Yeah, usually day 3 of fever is better to get admitted to the hospital, or otherwise if the platelet count is going below 150,000, or child is having abdominal pain or vomiting, or child is lethargic and not taking enough fluids at home, or any evidence of bleeding, the child has to get admitted to the hospital. Usually what we do in the hospital is we do daily full blood count to assess the platelet count and the blood concentration, and we monitor the vital signs like the pulse rate, blood pressure, and the circulation to detect the early complications of the dengue fever. Or even we can do a sometimes ultrasound scan of the abdomen and the chest. As the management, actually we basically do the fluid management, and we don't have a definite treatment for dengue, so basically what we have to do with the fluid management. Sometimes we can give IV fluids or intravenous fluids to the child, and depend on his condition. And so if the platelet count is very low, critically low, only we decide to give platelets, or very significant bleeding, only we decide to give platelets. Otherwise we usually don't give platelets for dengue patients. After the child is recovered from dengue fever or any complications, actually if you manage the complications according to the standard guideline, the death rate is less than 1%. So when the child is actually fever free for about 48 hours without any paracetamol, so that's a good indication. And other than that, if the general condition is improved, the child is started drinking properly, and his blood concentration is normal, and his platelet has started rising, and usually it should rise above 50,000 to go home, and so he will start passing more urine, and so all these conditions actually decide on whether the child can go home after the hospital stay. You have to use the preventive measures. You have to prevent the mosquitoes getting increase in numbers in your environment. So you have to reduce the breeding sites. So you have to change that flower pots or small water containers at home very regularly. And other than that, you have to keep your garden clean regularly, and you have to clean your gullies, your drainage regularly. You have to dispose actually, especially the any containers where the possible water can collect in proper way, and you can use any insecticide material or coil or vaporizers, or you can ask the child to wear lawn sleeves when the mosquitoes are surrounding, or when it is more during the day time. Yeah, so there's a dengue vaccine available in the world at the moment, and it is given in some countries, but it's not available in Sri Lanka. The WHO has not pre-qualified that vaccine is still, but actually Sri Lanka has agreed to participate in the phase 3 clinical trials for another dengue vaccine. So most probably in a few years time the dengue vaccine will be available in Sri Lanka.